The other topic you wanted to talk about here was Botox for face slimming, and I have to say I've not heard of this, so tell me a little bit more about what you mean by Botox is the botulism toxin that paralyzes. Okay, you tell me.
Yeah,
okay. You're the
so
expert.
I mean, generally, obviously, Botox now has become very popular. It's botulinum toxin, formulated Botox for cosmetic reasons, and it's FDA approved actually only for the glabella area. That means for the frown between your eyebrows. But as an off-label, it's used in several different areas of the face to help wrinkles around the crow's feet, forehead lines, things like that. There's a new area that works exceedingly well, and is actually very popular in this market, especially the San Francisco market, for several reasons. This feature where when someone has a slightly wider jaw or a fuller jawline area in this area, it's usually found mostly in Asian women, but not necessarily so. And a lot of women want to have a slimmer jawline, a slimmer looking face, so they come in asking for that. So one of the ways it works is that the Botox is actually injected into the masseter muscle. That's the main muscle that helps with chewing or mastication, your chewing muscle. So when you inject in there, the muscle starts to atrophy and you get a slimmer face. And so it works very effectively, and the results are quite long-lasting, and then amazing results. Because other than that, if you don't do Botox, then you're actually looking at very invasive surgery to get that result.
Okay, but I have to ask you this question. If you are hoping for that muscle to become atrophied, and that helps you with eating, does that affect your ability to eat?
What happens is after the injection is done, about a week later, you will actually notice a little weakness in your chewing. If you're eating a steak or chewing gum a lot, you'll notice that it feels a little weaker.
But
in about 10 days, your muscle
talking.
function returns back to normal.
Oh, it does? Okay. Yeah, I would hope so.
So it doesn't affect. So it's not
unless you're trying to lose weight at the same time.
It's not a diet.
Yes. Oh, I see what you're talking about.
So you can see how she has a very square jaw. It gives her face more width, and she's going for a slimmer jawline. So it actually kind of slims your face. It makes you appear like you've lost weight. But obviously it's only, you know, the doctor needs to check you out to make sure that it will work for you. So it's not for everyone. It's for a certain anatomic characteristic.
Okay, is this my imagination, or do her lips look fuller?
Your imagination.
Okay, all right. Do you have another picture we can take a look at? But that,
yeah.
I mean,
so this is
really
about a six month change. This is a 3-week change.
Okay,
on the right, so you can start noticing. So it starts subtly, and the reason we have this picture is to show that in about 3 weeks you start noticing effects, and it improves for several months after that.
Fascinating. Is that something that reverses? That if you stop using the injections, that
exactly. So just like Botox is only a temporary result, so in several months the face will regain the muscle mass and the shape will come back.